We're back with Dr. Larry Balle, who is helping us understand how sports medicine is evolving and how treating Olympic champions to helping everyday people live pain-free. He's at the forefront of regenerative care and healing innovation, and he's in Houston, so keep that in mind. One of the questions coming back is, do you see regenerative medicine becoming kind of a standard for injury recovery in the next 5-10 years?
Yeah, I mean, I think it's already getting there with a lot of people, and in reality, it's something that's better and overall healthier for patients at the end of the day. And so I think as far as management of acute issues, you don't have to use it for everything, but in certain situations, I think we'll start seeing that, arrow kind of pointing more towards using orthobiologics and regenerative therapy to get people back in less discomfort quicker than we have in the past 10 years or so.
If you can kind of give a better definition than probably I could on orthobiologics.
Yeah.
Because, I mean, I'll tell you right, I was screwing the name up as I kept saying it. It didn't roll off my tongue because it's very unique. But what is orthobiologics?
Sure. So when I talk to patients and I talk about things like osteoarthritis, that comes from several Latin, origins, right? So thinking about orthobiologics in the same respect, ortho is, bone and joint, musculoskeletal system. Bio is life, and logics is like the study of. So the study of like these products towards that. So regenerative medicine comes into play as another name. Cell therapy is another. Stem cell therapy. I had a guy, I was literally PRPing his knee this morning, and he said, "Hey, do you know anything about stem cells?" And I kind of chuckled, and my MAs are behind me laughing. I was like, I know a couple things, and I'm thinking like, what do you think we're about to do to your knee right now? So it has all of these different names, and it's all just semantics, so same thing. But what I specifically specialize in is how to apply these plasma products, so the biologic portion, to the orthopedic world, so the orthobiologic portion.
For somebody who's listening or watching that's struggling with the chronic joint pain or an old injury, what's kind of the first step in finding out if PRP and orthobiologics could help them?
Yeah, I mean, that's another great question. And I think a consultation to have an exam and an evaluation of what's going on, as well as a good history, to figure out what all has been done, and I tell patients a lot of times too that like we can start with the easy stuff, and if you get better, we're gonna leave it alone. If we need something else or there's something a little bit more severe, that's when we should maybe approach that orthobiologics. And I have certain patients that come in and they're dead set and they're like, this is what I want to do. And that's fine as well. But I think having someone put their hands on you that knows what they're doing as far as a physical exam of your musculoskeletal system, taking a history and listening to what's going on and what all you've done and what all hasn't worked in the past, and then talking about options going forward. And then if orthobiologics or regenerative medicine falls in that category of a good option for you, that's the next step.
So, after they go through the procedure, do you work with the physical therapist or the athletic trainer or whoever it might be to kind of set up the programs to kind of go forward?
Yeah, where I was at the University of Arkansas, I was really fortunate to have a group of amazing physical therapists that had specialty training on top of just basic DPT, so physical therapy education, and we developed a lot of protocols. I've brought a lot of those protocols here with me now, and there's several therapists around the city that I have specifically that I work with. Some of them are in different groups, some of them are within my group, and we have designed protocols based off of certain things. So whether that's a hamstring versus an Achilles versus a rotator cuff, or even a joint. So working with them hand in hand and that collaboration is super important to me, and I think that's what really gets that patient that much more benefit out of the recovery process.
You just mentioned Achilles, and I can think of this year in the NBA, the rash of Achilles injuries. What do you think that's kind of prompted to? Not trying to put you on the spot, but why has there just been a rash of them?
I have this handout in my office, and I give it to a lot of patients. And shoe wear is a really big deal. And I had this debate with another ortho guy, and we were talking about it. Basketball shoes tend to have zero arch support. Basketball guys are on their feet constantly, just like track, and their arches tend to collapse, and their feet tend to become more flat. When your foot becomes more flat, you end up putting more stress and pressure on the Achilles tendon. So you add that combination as well as plyometrics with basketball and jumping, and it's a recipe for disaster.
Wow, to me as a coach, that is so remedial in a thought process, but it's something I wouldn't even have thought of when I think about why it's all happening. And you have all these people having their own shoes and different shoe companies and all that kind of stuff. And it's not bashing on a shoe company by any stretch of the imagination. It's making sure you have the right footwear for your body, as opposed to, hey, these shoes look good. It's what works for you. Would that be good advice for just the person that's out there running or, playing pickleball? Because I've heard a lot of pickleball injuries too. I haven't ever broached pickleball, but I've heard a lot of stories about people getting injured, getting into it and doing it, and footwear might have an issue for that.
Definitely. I mean, not everybody's foot's the same. Our feet are meant to move, and our feet are meant to move differently with different activities that we do. And so thinking about that, you're not going to wear the same kind of shoe with basketball as you would with pickleball. But you think about the movement, just like tennis, right? Tennis and pickleball, you're going to have a different type of mechanics, just like sprinting with track. I met with some shoe engineers of a very well-known company that has their logo on several different teams around the world. I'm sure you can imagine. And the coaches at Arkansas wanted me to talk to them and go over it. And their biggest thing was how it looked, basically like whose shoe it is, not the function in preventing injury. So that kind of plays into what you just described too, with everybody having their own, individual brand.
And, and athletes, injuries for athletes become, magnified because they're on TV. But the everyday person, people get hurt all the time. And they're always needing help or resources. Are there any resource places that you can think of, or can they go to your site to kind of get some documents to say, hey, like this might be able to help me out in my physical journey to get in better shape?
Yeah. In the age of the internet and Instagram, there's a lot of misinformation out there.
Yes.
So, and YouTube is another example too. And I'll use YouTube to explain things to patients sometimes and to give them additional videos to watch as far as like rehab. Yes, there's some information on our website and there's some, I would encourage anyone that if you are looking for additional information, ChatGPT is probably not the best, option for that. And there's a reason why my job won't be replaced anytime soon by AI. But, looking at a more of an evidence-based source, whether that's a physician website or a hospital website or, a physical therapist type website, or you can go look at research papers and literature based off of that.
Okay, you just mentioned the internet and social media. And it seems like more and more people try to get their expertise from that. So I let you give your comment on that about, the cautionary tales of, well, YouTube said this or TikTok said this.
Yeah.
Do you have patients come in and say, hey, well, doc, I saw that they're doing this on TikTok.
Yeah, I mean, and it can be anything, right? It
Right.
can be whether it's an exercise or like you mentioned shoes before. Well, I was told I need this, and I'm like, oh, okay, who told you? And they're like, well, I saw this on TikTok, and I'm like, yeah, okay. Well, and I'll explain to them like what's why they do not need that. Barefoot, flat foot weightlifting is a big thing right now, and there's certain things where barefoot, flat foot weightlifting helps, but not all of those guys on Instagram that are influencers that are talking about lifting understand true foot mechanics or hip mechanics to be able to fully influence you in the right way of what shoes should buy. They're probably getting paid based off of your click on that shoe wear website. So I have that conversation often.
I can only imagine the Instagram gurus out there that give great medical advice, and they're walking through a grocery store. I see that on a regular basis, and I kind of chuckle a little bit. It's no different than coaching.
Yeah,
you see all these people that have these great theories on speed development and strength development, and you're going, I've never heard of you as a coach, and I've been in it around a little while, so I can only imagine no difference in the medical side.
Yeah, I mean, you can't get mad, right? And I enjoy a challenge, and so if someone is bringing that to me, I'm more than happy to talk about it. It happens. It's part of any field, and now that with the education and misinformation that's out there, it's going to come along.
What do you see as the next step in regenerative medicine?
Yeah, so that one of the proteins in particular that I mentioned from plasma is called alpha-2 macroglobulin. That is one specific protein within your plasma that's a protease inhibitor. So it actually stops the inflammatory process that's going on in joints. It's very good. However, what we're learning is to get that, several other things come along with it. So to isolate that out of the plasma, and what we're theorizing is there's other things in your plasma that can be used for various types of things. Hair loss is a big one.
It's a big one.
It's coming along where all these proteins are being thought about as well. So it can be applied elsewhere, not just to orthopedics and sports medicine.
Man, such an enlightening conversation. This has got me thinking a million miles an hour, which I don't need that because I think a million miles an hour all the time. But again, real quick, where can somebody, find out more information about you, about the practice? How can they do that?
Yeah, I think the easiest thing is just Google my name and my practice will pop up. You can always make an appointment or call. You can also get on my Instagram, and I get DMs like I mentioned all the time. LinkedIn is another easy way. It's a professional way to get a hold of me. And a lot of times what I do is I end up just taking that information and sending it to my scheduler, and my scheduler reaches out to you and gets you set up with a consultation. And that's a great start, is to have a conversation and see what happens from there.
Dr. Balle, thank you so much for joining us today and shedding light on a powerful, game-changing tools that are really transforming how we heal and perform. It's incredible to know that the future of sports medicine is not just about faster recovery, but about smarter, more personalized, and less invasive situations. So our viewers who are living with pain or recovering from an injury, know that there is hope and healing that can be closer than you really think. We hope today's episode empowers you to ask questions, explore new options, and take the next step to feeling like yourself again. I'm Bryan Fetzer, and you've been watching The Game Changer, where performance meets possibility. We'll see you the next time. You crushed it.
Thanks.
You crushed it.